You're tuned in to The Andrew Lawton Show.
Wanted to shift gears here to healthcare, the other hot button issue. Now, this is such an infuriating one for so many people because virtually every Canadian who's had some exposure with the healthcare system has experienced something that didn't work the way it was or the way they thought it was supposed to, whether it is cases of people being treated in hallways, people who have been on waiting lists for months and months and months to see a specialist, not to mention to, actually be treated by that specialist. So we all defend the ideal of the healthcare system in Canada, but not the application of it. So how do we get to that ideal? Or is it that our core expectation is flawed? Well, one of the things that's quite interesting, and I'm actually surprised to see this, is that most Canadians would be open to and welcome major changes to the healthcare system. There was a Leger survey of 2,000 Canadian adults. That's quite a large sample size for a poll of this nature. That found healthcare ranks among the top 3 priorities for politicians, and that 2/3 of those respondents said they wanted significant changes to the system. Now, these obviously have, in some cases, come up against challenges in the courts. Most recently, the Cambi surgical case in British Columbia, which I'm sure we can talk about in this context. But let's just talk about what Canadians want here and what's standing in the way. Joining me is counsel for the Canadian Constitution Foundation, Josh Dehaas. Josh, good to have you back on the show. This is a little bit encouraging, I must say. It was a pleasant surprise to see this because so often this is treated as just this third rail political issue that you're not allowed to do anything with.
Yeah, absolutely. So in one sense, it's, really bad news because Canadians see a healthcare system that's in crisis. But what I did find encouraging is the fact that Canadians are saying they're ready for major change. So like you said, 2/3 say they want major change, and only 5% of people actually say that they want to do the thing that you most often hear in the media, which is, just throw more public funding at this problem, right? So people are presented with those options: more public funding, or some major change, and everyone is basically saying we want major change. And one really interesting part of this too was it was kind of counterintuitive to us at the CCF, but women in particular are saying that they are worried about the healthcare system and want major change. 72% of women surveyed said that they think the healthcare system is going to be worse for future generations if we don't get those major changes. And that was a lot higher than men. And we're trying to figure out why that was. But we think the reason might be that women just make a lot more of the healthcare decisions. They do a lot more of the sort of caregiving. And so that might explain why they're more worried about it, simply because they, interact with the system a lot more.
You have in this country a relatively small group of activists that care very much about the structure of the system, like Canadian Doctors for Medicare, for example. But most Canadians, I feel, care more about outcomes. And you look at some of the priorities that were listed here. 46% say they want more family doctors as a top priority. Shorter emergency room wait times was behind that. Shorter times for common surgeries and other treatments. Those have nothing to do with who delivers it, with how they access it. Those are just outcomes. Those are things that people want. And I believe that if you were to put forward a system that says, listen, you're not going to go bankrupt looking for healthcare. That's not what we're pushing here, but you will get a better, quicker product. Canadians would be on board with that. But you have, again, this very small group that stands in the way of that.
Yeah, you're completely right. One thing a lot of people I don't think realize is that, a lot of the opposition to any sort of reform or change in the Canadian healthcare system, a lot of that's sort of funded by sort of special interest groups like, healthcare unions. And what the message that a lot of Canadians are not hearing is that, Canada is just one country in the world, and we've chosen to have a very strict restrictions on private payment for healthcare. But, if you look at all of Europe, they have universal healthcare. You don't have to pay with your credit card if you need healthcare, if you're poor, if you're middle class, if you want to access the public system. And most people are getting their healthcare through the public system, but they also have this sort of release valve, which is that they have a private system where if things aren't working, some wealthier people can go and they can pay to get healthcare. And that takes pressure off the public system. And the proof is in the pudding. If you look at all the rankings that look at outcomes and wait times and even equity, all of the European countries are basically doing better than Canada. So I think we really need to start, pushing back against that sacred cow that we can't allow any sort of private payment in Canada.
Just to bring the legal context here, I know the CCF had taken up the long running Cambi case in British Columbia there, which I spoke about. I think it was with, I can't remember if it was with Joanna Barron or Christine Van Gyn or both, but when the decision came up. But as a bit of a primer there, how does that decision stand in the way of what you and I are talking about and Canadians seem to want here?
Well, so British Columbia, like most provinces, has some restrictions on, doctors work offering private surgeries or doctors or health insurance, and each province is a little bit different. But the idea is that Canadians supposedly want a government monopoly on healthcare, and so we've got all of these restrictions. And in that particular case, we said, if you're waiting on a waiting list for a surgery and you're in physical pain and you could pay to relieve that, but it's just a law standing in the way, an arbitrary law that is supposed to guarantee you reasonable access to healthcare, but is actually forcing you to wait on a wait list. That's violating your constitutional rights, and that shouldn't be allowed to stand. And, there's a 2005 case that found that to be the case in Quebec, but it doesn't apply in the rest of Canada. So we thought that in British Columbia we would be successful, but the courts there said, no, this is a reasonable limit on people's charter rights, even though people suffer and in some cases die on waiting lists. And so right now it's still apparently acceptable to do this in British Columbia. And we don't really know what the status is in the rest of the provinces. So we're always sort of looking for our next Cambi case. The fight certainly isn't over.
Well, and there I think underscores how the ideology is getting in the way of the outcomes here. Because, if someone pays out of pocket to take themselves off a wait list and there's an available doctor, an available surgical center, no one is worse off. Like absolutely no. In fact, the public system is better off because one more person has come off that wait list, which helps the person behind them. So I really don't get how you like. It's such an inexplicable decision. Just not even looking at the law, just on the logic of it.
Yeah, that's right. Yeah. I also don't understand that. Like you can look at, for example, look at Norway, and it's the country that ranks better than any other country in, the OECD for its healthcare outcomes, for its healthcare equity, and it does better on cost than Canada. Canada has a very, very expensive system. And, they have only about 10% of people there have private insurance, and they get, some specialist appointments quicker. They do get some surgeries quicker, but it's optional. And 90% of people are happy with the public system and stay in that system. But just taking that, 500,000 Norwegians out of the public system makes the waiting lists in the public system shorter for everyone. And Norway can actually do a lot more in their public system because they're not because they don't have to look after 100% of the population all the time. An interesting sort of result from this survey that we did with Second Street and MEI was that Canadians actually rank pharmacare extremely low. Their priority, it's like ninth out of 9 options. Only 3% said it's their top priority. And that's because Canada can't seem to figure out the basics, like getting you your family doctor or reasonable ER wait times. Norway, or they can afford to actually do pharmacare because they also allow some sort of private money into the system. So I think it's pretty clear at this point that Canada's system isn't working, that it's violating Canadians' constitutional rights. And the survey that we've just done seems to show that the public is kind of ahead of the media and some of the sort of politicians on this particular topic, because Canadians are ready for change.
Now, one thing, I mean, maybe I'm a bit of a dolt, so it's probably easier for you than for me here. But it's navigating this issue of what is legal and what is just tradition has been incredibly difficult. I mean, Ontario is a great example of this, where you've got a couple of literally private hospitals that are there because they've just been grandfathered in. You have federal regulations, but healthcare is provincial, and I think a lot of that jurisdictional ambiguity is used by politicians that don't want to touch this issue. Provincial leaders will say, oh, well, the federal government handcuffs us on universal healthcare. The federal government will say, oh, well, healthcare is a provincial issue. So at its core, if we wanted to have some progress on this issue, where's the starting point? Where's the way into that? Is it at federal level with the core Canada Health Act, or is it provincial?
Yeah, I think it's actually both. So the Canada Health Act is not as clear as people think it is. So just for a little bit of background.
I'm glad I'm not alone in being utterly confused when I look at it then.
I was reading about certain aspects of it last night, and it's confusing. So the basic idea behind the Canada Health Act is that the federal government is going to give provinces money to spend on healthcare, even though healthcare is a provincial jurisdiction, right? So but to do so, Canada, in exchange for that money, wants certain guarantees from the provinces. For example, that people are not going to be charged user fees or things like that. But there's so much ambiguity in it. One really good example is diagnostic services. So, getting an MRI. Most of Canada, you can walk into a private clinic, put down your credit card, and get off the public wait list if you want to by paying for that MRI. Well, one of the places you can't do that is Ontario, unfortunately. So, we're stuck going to Gatineau or to Buffalo if we are worried about being stuck on a wait list. So,
oh yeah, so I live just on that. I live an hour from Port Huron, Michigan. You cross the border and billboards advertising to Canadians, get your MRI, $129 or whatever, go here, open 24/7.
Yeah, we have them. I'm in Toronto, and we have them on the subway saying, go to Buffalo for all your surgeries or services. But anyway, the point is that the federal government and the provinces don't even seem to know whether that is supposed to be covered under the Canada Health Act. And the Trudeau government in 2018 said suddenly, actually, this should be something that provinces are required to not only pay for, but stop anyone from buying privately. And so, in our opinion, this is contrary to the Canada Health Act. And they started fining provinces like Quebec and Alberta and British Columbia just for allowing people to get out of the public wait list line, go to a private clinic, and pay to have the healthcare that they need. So there's a lot of ambiguity. And I think you could clarify the Canada Health Act. I think it allows provinces to do a lot more than they say that it does, but there's no reason why the federal government couldn't clarify the Canada Health Act and say, look, we're still going to fund universal healthcare. We're still going to give you just as much money, but we're going to let provinces innovate to some degree because the status quo just isn't working. So, if I was in charge, I'd probably start with just clarifying that Canada Health Act.
Well, yeah, there we go. And obviously, with polling, I mean, the cynic in all of us says politicians are responsive to polls more than their core convictions sometimes. So if that's the case, your move, political class. You can read more about this at theccf.ca. Josh Dehaas, always good to talk to you. Thanks for coming on today.
Thanks, Andrew.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.